when a client comes into cognitive behavioral therapy, you would need to empathize with that client, that Black client, about what they are experiencing. That could be especially true, like following an event such as the murder of George Floyd. So it would be important for the clinician to not say, well, that's a one-off. It happens routinely and is well documented in the research.
Welcome to Advances in Social Work, the platform that's based on the IU School of Social Work's academic journal, but we talk about things that are not in the journal as well. And this is one example of them. I have with me here Dr. Virgil Gregory, who has recently released his book. It's called Cognitive Behavioral Therapy with Black Americans, a principle and structurally informative perspective. Now, that title sounds pretty straightforward, but if you wouldn't mind, Dr. Gregory, can you first tell us about yourself?
Sure. I'm currently an associate professor tenured at the IU School of Social Work. My research looks at cognitive behavioral therapy for Black Americans and cognitive behavioral therapy for addictions. Some of the research methods that I use are psychometrics or scale development, meta-analyses, clinical trials, and qualitative research too.
So, that's a little bit about who you are and your research. Now, tell us about the book and what drove you to write this.
Okay. Cognitive behavioral therapy is the most researched psychotherapy that exists. However, there is less research about Black Americans, and there's not enough literature, behavioral science literature regarding cognitive behavioral therapy for Black Americans too. The principles for cognitive behavioral therapy are well known. And one of the things I talk about in the book is that in probably the most popular cognitive behavioral therapy book, they talk about how the intervention can be culturally adapted. And that's the principle. However, that principle doesn't tell you how to adapt cognitive behavioral therapy for Black Americans. So my book provides clinicians and graduate students with information on how cognitive behavioral therapy can be culturally adapted for Black Americans who experience structural racism.
So it's based on a thought process and a school of thought that's already out there, and you drill into it specifically for the Black American perspective. If I'm correct, it's mainly about Black men. However, the things in this book, they can cross gender, but they can even cross culture at some point, based on the cultural responsiveness. Correct?
Well, there is definitely some explicit attention to Black men. However, there's also explicit attention to Black women. It's more applicable to Black Americans overall. However, there are aspects of the book where I go into more details. For example, in the final chapter, I talk about the application of the cognitive behavioral respecters principles for Black men, Black American women, and its potential translation to other places where structural racism exists. For example, South Africa, Canada.
Well, before we get into those 10 principles, who was this book written for? You mentioned it's for students and clinicians, correct? Is that as far as it goes, or can other people get value from your book as well?
Well, it was definitely written for practicing clinicians, students in social work, psychology, psychiatry, public health, also researchers who research mental health and health issues pertaining to Black Americans will also find the book useful. I personally believe that if someone is interested, like a layperson, they too can pick up the book and read it. I try to not go too deep into any research concepts, but I try to explain it in such a way where it could be useful for the readers. So it's written in a way so that it has broad applicability, but I believe it can also be of use for laypersons as well, in addition to graduate students, clinicians, and clinical researchers.
What kind of structural, systemic racism is in the field of research?
So, structural racism, the way I define it in the book, it's also well referenced too. There's a lot of references throughout the book as well. So it's racism that is created by laws and policies. In chapter 2 of the book, I talk about how the Constitution, state level statutes like black codes, Jim Crow laws, how those contribute to health disparities for Black Americans, distrust of systems, and other negative issues that influence cognitive behavioral therapy with Black Americans.
So you go into how, I guess, the patient side experiences it. And then my assumption is that the principles that you referenced earlier are principles that clinicians and researchers can use to kind of almost not work through the systemic racism in the field, correct?
Exactly, exactly. In addition to using the principles in the context of cognitive behavioral therapy to address the needs of Black Americans, Chapter 3, for example, focuses on the clinician looking at themselves. So Chapter 3 is on implicit racial bias and its implications for cognitive behavioral therapy. I talk about self-honesty as being really important, and I talk about the ways in which structural racism can negatively influence cognitive behavioral therapy, be it issues with establishing rapport, issues in writing about clients in clinical notes, issues in cognitive behavioral case conceptualization, issues in treatment plans. So there that's basically the prerequisite chapter or information that is provided so that clinicians can address the principles. And then the chapter after implicit racial bias in cognitive behavioral therapy, then the next chapter is the respect us principles for cognitive behavioral therapy with Black Americans. Because I believe that once clinicians take a look at that, they would be in a better mode to actually receive and apply the cognitive behavioral principles, respect us principles for Black Americans.
I realized I should have asked this at the top for in the event that someone who's listening is not a social worker or a health professional. Can you give a quick explanation of what cognitive behavioral therapy is?
Yes, cognitive behavioral therapy is the most researched psychotherapy there is. It's based on the theory that how you believe or what you believe determines how you feel and behave. If an individual's beliefs about an event are accurate, then usually the consequent emotions and behaviors are appropriate. However, if somebody perceives an event inaccurately, then their emotions and behaviors may be disturbed. In that case, you can change the person's beliefs via Socratic questions, behavioral experiments. Included in cognitive behavioral therapy is the fact that sometimes people perceive things correctly. For example, sometimes individuals perceive racism, be it interpersonal or structural in nature. In that case, you would want to problem solve. And problem solving is also a big part of cognitive behavioral therapy. And given the impact of structural racism, it's a big part of my book as well.
And then, so the part of, I guess, the therapy part itself, that's the clinician understanding the perspective of the client or the patient, and then helping that patient build a plan to work through the situation that they're going through, whether it's a mental health situation or just any other thing that brings up them there, right? Is that correct? For, I guess, what the layperson might kind of view as talk therapy, kind of sitting on the couch and talking through the situation.
Yeah, it could be mental health issues, it could be quality of life issues, it could be the mental health implications of structural racism.
Hmm.
It could be the mental health of other types of racism that stem or are rooted in structural racism.
You mentioned your respect us principles, and that those principles are something that the clinician can use or even the researcher can use to overcome the structural racism that's in the systems, correct? Can you run through what those principles are?
Absolutely. So the acronym is Respect Us, pronounced Respect Us with two P's. The
Hmm.
first is R, which is resilience and strengths of Black Americans. E is expressing empathy for cultural trauma. S is structural racism's importance. P is problem solving because if the issue is indeed structural racism, then there is something in the social environment or in the laws and policies that need to change. So it's not just looking at Black person's beliefs and getting them to change their beliefs about structural racism. So that's where the P, problem solving, comes in. Then the other P in the respective principles is policy. That's because there needs to be a change in policy to address the upstream causes of some of these downstream psychological effects of structural racism. E is evaluating the thoughts and beliefs of Black Americans. C is the critical evaluation of research for Black Americans. T is truth and transparency. U is the uniqueness of each Black individual, so we're not all the same. And then S is social supports imports. The principles are also, and I state this explicitly in the book, they're interdependent on one another. So they should be used in conjunction with one another. Now, if one is more important than the other, that actually just depends on the client that is in front of the clinician. For example, some people maybe they haven't experienced structural racism, or that's not the reason why they're there. Then you can apply other aspects of the respective principles. But it kind of depends on the client. I will tell you this, there is some research where clinicians believe that validation is more important than cognitive restructuring. Cognitive restructuring is when you ask questions to challenge a client's beliefs about a situation. And hopefully, once a client challenges inaccurate beliefs about a situation, their mood and behavior will improve. That is important if the clinician is coming into it that validation is the only thing that matters. So in that, principle 6 would be especially important in that one. If a client is experiencing something with structural racism, then being able to empathize with that, being empathic towards cultural trauma or having negative experiences with police, even though the clinician, him or herself, may view police very positively. So they're all important, but which ones may be more important or less important for a particular client all depends on the client, but they're all important and they should all be used interdependently with one another.
Is there any particular thing you can think of in current events in the news you look at and say, man, if this person had access to this book or if this person knew these principles, they could approach this situation differently?
Yeah, well, one thing I'll go to that was fresh on my mind when I started a lot of the research that is also included in the book, I cite others' research as well, was the George Floyd issue.
Hmm.
So sometimes clinicians will look at an event that gets a lot of media attention and they will think, oh, this is an isolated event because it's garnered a lot of media attention.
Hmm.
One of the things that I've written about in my research is that these things exist whether they get media attention or not.
Yeah.
So when a client comes into cognitive behavioral therapy, you would need to empathize with that client, that Black client, about what they are experiencing. That could be especially true, like following an event such as the murder of George Floyd. So it would be important for the clinician to not say, well, that's a one-off, or that never happens. It happens routinely and is well documented in the research and in various areas.
And what would you say to that clinician who downplays the impact of the structural system that created an environment that allowed George Floyd to get killed that way? How would you have them use the action steps, or like how would you have them go through the process to get over that for themselves?
In chapter 6, I talk about how the principles are integrated within the context of cognitive behavioral techniques. So I state explicitly that when a clinician is not empathic towards or minimizes the impact of structural racism, it does several things. One, it decreases the therapeutic rapport. It can decrease the therapeutic rapport or the relationship with the client, decrease trust with the client. If the client doesn't trust you as a clinician, then they are less likely to divulge and be vulnerable about their thoughts or things that they believe, which requires some trust to expose. If the client does not trust the clinician, and is not forthcoming about their thoughts and beliefs, then it kind of it has a strong it impedes the cognitive restructuring because first you need to identify the thought before you can systematically challenge it.
Mhm.
If trust is not present, then the thought cannot be analyzed any further. And again, sometimes the thoughts are true. And if the clinician doesn't provide enough therapeutic rapport where the Black client can feel comfortable discussing issues of racism, then problem solving can occur. But in one sentence, the big problem with that is that it impedes the therapeutic rapport. And what we know is that cognitive behavioral therapy is dependent on a good therapeutic relationship.
I know a lot of people look to have a clinician that looks like them or a clinician that they share an identity with, therefore they can understand them better. And what I hear from you is this book for a clinician can help try to overcome that particular lack of connection through identity. And not specifically overcome it in that this person is going to be the best clinician for Black people there ever is, there ever was, but in the sense that the thing that a Black person might try to avoid by getting a Black male or female therapist or clinician, that particular thing is what this book kind of hits at and says, this is what the Black experience, how it could be connected with rather than pushed to the side. Is that correct?
That is absolutely correct. And I talk specifically in the book about how the principles can be especially useful, at least the way I perceive them, if the client is hesitant because they have like a non-black therapist. My belief is that the principles should help the clinician address some of the issues which could be problematic. I talk explicitly about white clinicians and black clients, and things that can occur or may not occur, which may help or hurt the development of therapeutic rapport. But yes, it's also it can be useful for anybody that's providing cognitive therapy to Black Americans, and it can certainly be useful also for white individuals or other non-Black individuals who are providing therapy to Black American clients.
Are there any, I guess, bite-sized action steps that you can give to clinicians who are listening who do want to overcome that barrier on their end of feeling like the potential client won't feel connected with them?
Things that have come up in my and others' research is therapeutic rapport. And the 10 principles are equally important, but I state explicitly in the book that I use the acronym Respect Us because that speaks directly to therapeutic rapport. In the book, I talk explicitly about it. It respect how important it is for Black men in cognitive behavioral therapy and Black women in cognitive behavioral therapy. If there is one thing that I would walk away with or that I would convey is that respect is very important. Not respecting the clients can certainly impede therapeutic rapport and any other progress that the clinician is trying to make with the client. And that is kind of one of the bigger things of the respect us principles. Each particular principle speaks to an important component of cognitive therapy that is believed to advance cognitive therapy or CBT with Black Americans.
Is there anything else about the book that we have not touched on yet that you think you would like people to know about it?
Sure. The book is available and they can get the hardcover. It's at Springer Nature. If they can Google cognitive behavioral therapy with Black Americans, or they can go to springernature.com and they can, search for the book Cognitive Behavioral Therapy with Black Americans. There's a discount code which gives them 20% off, and it's SPRAUT. And that will give them 20% off the book. And when they get the book, if they reach out to me on LinkedIn, I would love to know their thoughts about the book. And yeah, anything that they would like to share with me about the book, I would greatly appreciate it.
Is there any feedback that you've gotten so far that you loved or maybe didn't love?
Other than people telling me that they're going to buy the book, the only other feedback that I've received is that it's way past time and that they're glad that it's here.
Mhm.
They're happy. The clinicians are happy that it's here.
That's good. Well, thank you again. Again, we're here with Dr. Virgil Gregory Jr., just fresh off the release of his book. And from this conversation, it sounds like that this book is very well researched, is very well documented, very well cited, and it seems like it could do a lot of good for the people receiving care as well as people giving care. And as someone who is a Black American who receives care in this country, I'd appreciate you taking the time to write this book and to research this book. And thank you for speaking with us today.
Thank you so much for having me. I really appreciate it.